Good morning, everyone. I echo Cynthia's chat message, which is welcome to our third State Plan on Aging virtual listening tour. We thank you for being here today. We thank you very much. Looks like we have a small crowd, but a good crowd today. So I don't know, Christine, if we'll have a chance later to hear who's all on the phone, but we very much appreciate you joining us today. Again, this is our third listening tour. It really is our objective to present this slide deck and then have an opportunity for you to ask questions, talk to us about the Older Americans Act services, get some feedback from you, tell us what is working and what you would like for us to consider. Let us know also if you've got concerns of services that are not working as well as maybe they possibly should. The Older Americans Act has been around since 1965. It was signed into law at the same time Lyndon B. Johnson signed Medicare and Medicaid. The Older Americans Act was signed into law. If you're curious at all about the history of the Older Americans Act, it is rich and interesting, and honestly, if you do some research, you will see that the impact of the services delivered under the Older Americans Act are significant, to say the least, when it comes to lifting seniors out of poverty, to some degree, helping seniors receive nutritious meals, and many other services that we appreciate delivering through the Older Americans Act program. So we are interested in hearing from you, from your vantage point, what's working again, and possibly what could we consider as we develop our state plan. We acknowledge that COVID is at the forefront of our minds these days. We spend a good percentage of our days at KDADS talking about COVID, responding to COVID, modifying our delivery systems in response to COVID. So unequivocally, it has taken an inordinate amount of time for us since March to incorporate COVID into our communication. But today, we'd like to hear from you about COVID and your COVID concerns, but also share with us your insight from more normal times, if you will, recognizing that we may never completely go back to normal, and that's not a bad thing. If we have found creative ways to deliver meals in the future, let's do so. If we have found creative ways to visit with our consumers, let's consider what those ways might be in the future, particularly when it comes to telehealth, for example. So we are very excited to hear from you today. Please feel free to speak up. Please feel free to share your thoughts, share your insights. We are actually here to listen. So again, thank you for joining us. And Christina, I will hand it back over to you.
All right, thank you, Janice.
Sure.
So my name is Christina Orton, and I'm the Aging Services Director for KDADS. I would like to take a minute to introduce Gabrielle Risley, who is the Older Americans Act nutritionist, and Cynthia Harris, who is the Older Americans Act and Senior Care Act program manager. Gabrielle actually is the one hosting the meeting, and her host name is actually Ann Yakeley at the moment, so I don't know if you can wave or raise your hand and let them know who you are.
Good morning, everyone.
So this listening session for the State Plan on Aging is conducted to gather your thoughts on services provided by the KDADS Older American Act program, referred to as OAA. This event means a great deal to the state of Kansas because it allows seniors to voice their needs and allow us and the Aging Network to develop goals to better serve older Kansans. Our mission here at KDADS is to protect Kansans, promote recovery, and support self-sufficiency. We achieve our mission through major program areas such as home and community-based services, long-term care, behavioral health services, state hospitals, and nutrition services. Our aging services. These programs provide a wide range of services, including, but not limited to, aging services such as Aging and Disability Resource Center, so ADRC, Older Americans Act, OAA, Senior Care Act, SCA, Medicare programs such as Senior Health Insurance Counseling for Kansas, which is also known as SHIC, Senior Medicare Patrol, SMP, Medicare Improvements for Patients and Providers Act, MIPA, Client Assessment, Referral, and Evaluation, CARE, and Program for All-Inclusive Care for Elderly. A little background information on OAA. It was originally signed into law in 1965 and established the Aging Network, which provides community, social, and nutrition services for older persons and their caregivers. Since 1965, there have been many reauthorizations of the Act, including the recent 2020 reauthorization through 2024. The Older Americans Act funds services that keep older adults healthy and independent in their homes. In accordance with the Older Americans Act of 1965 as amended, KDADS, as the designated state unit on aging, submits a state plan on aging to the U.S. Administration on Aging every 4 years. This plan describes the agency's vision and purpose, including the goals and strategies to achieve this vision. Development of this plan is accomplished through interaction with the Kansas Aging Network. The Older Americans Act is the most comprehensive legislation composed by 7 titles. KDADS administers the grants for OAA Title III and OAA Title VII. These are the grants for state and community programs such as supportive services, which include, but not limited to, homemaker, attendant care, transportation, case management, legal assistance. Nutrition, such as congregate and home delivered meals and nutrition education. Disease prevention and health promotion, which includes evidence-based health promotion and disease prevention programs. Then family caregiver support, such as respite, counseling, information, support groups, and homemaker services. Title VII are grants for elder rights protection, such as long-term care ombudsman program, prevention of elder abuse, neglect, and exploitation, and state legal assistance development program. The purpose of our state plan on aging is to outline the primary responsibilities of planning, policy development, administration, coordination, priority setting, and evaluation of all state activities related to the objectives of OAA. The Kansas Aging Network shall serve as an effective and visible advocate for older individuals by reviewing and commenting upon all state plans, budgets, and policies which affect older individuals and providing technical assistance to any agency, organization, association, or individual representing the needs of older individuals. The Kansas Aging Network shall also assure that preference will be given to providing services to older individuals with greatest economic need and older individuals with greatest social need, with particular attention to low-income older individuals, including low-income minority older individuals with limited English proficiency, and older individuals residing in rural areas. To meet the needs of older Kansans, KDADS administers programs throughout the state, primarily through local area agencies on aging, also known as AAAs. The Kansas Association of Area Agencies on Aging and Disabilities, also known as K4AD, represents all 11 of the AAAs that coordinate services, assess, provide information, case management, and numerous other services for seniors in all of the 105 counties in Kansas. To learn more about services offered in your area, you can dial the Aging and Disability Resource Center at 1-855-200-2372. The Older Americans Act plays an important role in the lives of older Kansans with services and programs provided throughout the 11 AAAs, 3 tribal organizations, 165 Title III service providers, and hundreds of invaluable volunteers. In 2019, nearly 33,000 older Kansans were served through OAA Title III registered services such as congregate meals, case management, personal care, home-delivered meals, and homemaker. Providers in Kansas provided more than 3.1 million meals, 20,000 rides, and 10,000 hours of personal care to older Kansans. The National Family Caregiver Support Program hosted more than 1,000 counseling and training events and served more than 13,000 family caregivers with more than 35,000 hours of respite care to provide much needed relief. Lastly, the Long-Term Care Ombudsman's Office provided more than 1,000 consultations to help resolve complaints and issues on behalf of individuals residing in long-term care settings through OAA. In addition to these 4 listening sessions, KDADS Aging Services has developed a survey to gather feedback for our 2022 State Plan on Aging. We encourage our partners and customers to share the flyer and survey link with older Kansans and caregivers. The survey will be open until the end of March of 2021, and your participation is greatly appreciated. Please feel free to share this opportunity to provide valuable feedback with your families and friends. Written comments will be accepted through April 30th of 2021. You may send these comments via email to kdadsOAASCA@kas.gov or by mail with the attention to Christina Orton, Aging Services Director at 503 South Kansas Avenue, Topeka, Kansas, 66603. KDADS will be hosting one additional listening tour from 10:30 to 11:30 on Wednesday, December 9th. Please stay tuned and feel free to follow us on Facebook to learn more about the upcoming events and information regarding the 2020 listening tour. This is an opportunity to provide open-ended feedback, comments, and success stories regarding aging services in Kansas. The purpose is not necessarily to answer questions, but to provide any opportunity for public comment and to assess for unmet needs of older Kansans. As we move into the feedback portion, we would like to go over some more housekeeping notes. To provide comments, individuals with a computer access may raise your hand by going to your name in the participation list. Individuals with computer access may also type your name and county of residence in the chat area. And any individual on the phone may unmute themselves anytime by pushing *6. Please know the State Plan on Aging is intended to address seniors' current and future needs related to the Older Americans Act services. We acknowledge that the coronavirus pandemic is top of mind for many. However, the intent of this listening session is to gather input on unmet needs prior to the start of the pandemic. In addition to what Janice had mentioned earlier, obviously new needs have arose, and so any feedback related to the pandemic would be appreciated as well. Your participation will be used to develop the 2020 through 2025 State Plan on Aging. So please take this opportunity to share suggestions, needs, comments, and feedback about OAA and the aging services provided throughout Kansas. If you do not get a chance to speak today, please consider joining our last session, which is, again, December 9th from 10:30 to 11:30, or submitting any written comments. Please consider the following questions, which are listed on this slideshow. What Older Americans Act services are working well? Are there gaps in Older Americans Act and other aging services? What is most important for you to see in a program serving seniors? What are barriers to services? And social isolation and loneliness are prevalent, and these issues have been exacerbated by COVID-19 pandemic. How can the Aging Network address social isolation and loneliness? So at this time, I will turn it over to Gabrielle and Cynthia, and we will start taking any feedback.
At this point, Christina, you just want to open it up for responses to these questions and hear from folks?
Correct.
Okay.
So again, if you're on the phone, just push *6, and if you have are on the computer, just feel free to make a comment or unmute yourself.
Hello, can you hear me?
Yes.
This is Laurel in Wichita. We do the home-delivered meals. First question, what Older Americans Act services are working well? I think with COVID, we have really had to sort of reinvent the way we get our meals out. And it's been trial and error, but I think we're doing a really good job. Our volunteers, we've lost some of the older ones who didn't come back, but we've been fortunate. I think with COVID, people are paying more attention to our seniors and realizing that there are so many that don't have much interaction. So we've been very fortunate to get volunteers who want to help out with that. And just keeping them safe, stepping back from the door, bagging the meals, doing the 6-foot distancing. However, you know, we're not getting that interaction that they so treasure. But I didn't have anything to do with it. My staff have worked out a way to do everything safely, keep volunteers, only 4 at a time allowed, the 6-foot distancing in our kitchen. So it's been a challenge, but I think that we've been able to step up. So I'm interested to hear what other programs might be doing.
This is Kathy Laughlin Sack, and I didn't understand a lot of that because you guys were using big words, and we, as a self-advocate, we need that done in plain language.
This is Laurel. Do you want me to repeat that?
Kathy, this is Janice. We can ask Laurel to repeat, and Laurel, you might speak up just a little bit. What I heard you saying, Laurel, is that COVID has been a challenge as far as getting meals out to folks, Older Americans, meals out to individuals, but you've been able to recruit some additional volunteers and you've kept your distance and haven't had as much opportunity for actual face-to-face conversations with the folks you're delivering meals to, but they are at least receiving their meals, and that's a good thing. That's what I think I heard you say, Laurel, but please feel free to speak up again.
Yes, Janice, that is correct. We are just been fortunate.
Does that help, Kathy?
Can you hear me?
Hey, yes.
Okay. We have been real fortunate. We never missed a meal. Now, we did a lot of the shelf-stable box meals in the beginning.
Now, Laurel, you're cutting out just a bit.
Is this better?
That's much better.
Okay. Janice, you're correct. You summarized that very well. Yes, we're still delivering. I have to say we also never missed a delivery.
Great. So, Laurel, I might ask you, are your numbers of meals that you're delivering, are they staying consistent?
They go up and down.
Okay.
What we're seeing is a lot of younger, like 60 people coming on and going off because our meals are not sweet or salty enough for them. You know, they grew up on fast food, so that's a real challenge for us. But what we do is focus on the majority of our clients, which are older, 70, 80 plus, and going back to those comfort foods that they like, chicken and noodles, things like that. And so, you know, we've tried to experiment, but that fancy stuff just isn't working for the older ones. So we've got a lot of challenges, but I think we've stepped up to meet that.
Good. Glad to hear it.
Yeah, this is Kathy Goff from the South Advocates Coalition of Kansas.
Hi, Kathy.
Hey, I have one suggestion for you guys.
Okay.
You need to start using some words that South Advocates would like to hear, because a lot of those words I couldn't even understand this morning. So think about plain language when you're talking to somebody with a disability.
Yep, Kathy, maybe Christine and her team will have a chance to take this slide deck and run it by you all before our December 9th meeting. How does that sound?
That sounds great. I just wanted to make that point because starting in March, my new role is going to be working with the aging and IDD people.
Okay. All right. Sounds good, Kathy. Well, let us hear from Kathy and others as far as additional feedback. We appreciate hearing from Laurel on getting meals delivered under the COVID pandemic situation. So what else are we hearing? We'd love to hear from some other folks.
And again, if you're on the phone, that's *6 to unmute your line.
I have a question.
Sure.
I am trying to keep my brother physically active, and I am running into roadblocks everywhere I go, and I ended up just to the point where I just paid for his gym membership out of my own pocket because he doesn't qualify for anybody, you know, his Medicare or his Medicaid to pay for a membership to keep him healthy and physically active with his diabetes. And I think there should be a program out there somewhere that would be able to keep our older Americans and our physically and mentally handicapped people healthy through their insurance.
And there are actually 3D, I think it is, does allow the area agencies on aging to provide some evidence-based programming. So maybe this is a gap that you see in services. May I ask which county you reside in? Would you be comfortable telling us that?
Lyon County.
Lyon County and Emporia? Gabrielle and Cynthia, you might make a note of that gap as far as from this individual.
We live in Hartford, which is about 25 miles from Emporia, and we just joined I just joined the Emporia Rec Commission at Lee Barron's Activity Center to get him a means to exercise to keep him healthy. He's 63 years old.
Okay. Well, let us note that as a gap, if you will, and we'll make note of that, Cynthia and Christina and Gabrielle.
Sure. And also, if you don't mind me asking, would you be willing to fill out our survey? Because a lot of that information we can capture in that survey as well.
Oh, that's a great idea.
Yes, that's fine. That's great.
And Cynthia did include the survey link in the chat box, and then the survey link, Christine, is also on our website, correct?
That is correct.
Cynthia,
okay.
Looks like you...
I have can you guys hear me?
Sure.
I have a comment from Arlene Winter. She said, out here in Western Kansas, it is a challenge to get services such as Meals on Wheels in small towns.
Marlene, you might consider taking our Survey Monkey survey also so that we can get a better sense of which counties you're referring to. May I ask, are you in Western Kansas, the northern half of Western Kansas, or the more southern half of Western Kansas, if you're comfortable answering that? Pawnee County? Oh,
Pawnee County. Mm-hmm.
Lyon County is east Kansas.
Pawnee. Yeah, she's saying Pawnee, so we're talking Western Kansas, Pawnee County. Okay, good to know. Christina or Cynthia and Christina will make a note of that.
Yes, thank you, Marlene.
Good to know, Marlene. Huh. Okay.
She is saying there are a lot of counties around them that have the same situation.
Right. Okay, well, thank you for that. We'll make a note, and we can note that internally and visit with you more, hopefully, from the Survey Monkey and get a better sense of where that might be, besides Pawnee County, in addition to Pawnee County. So, good to know. So we've talked about physical activity, meals, what other barriers might be out there in addition to those? And also talk to us about your COVID-19 experiences, if you would like also. We do know there is social isolation. I will share with you, we are hopeful that through the Governor Kelly's Spark Recovery Office, we are hopeful that we're going to be able to get some refurbished tablets out to some seniors. The area agencies on aging across the state are going to help us make that happen with focus primarily on isolation and telehealth. So if we can help ensure that older Kansans stay connected to their physicians and their families, that is our objective. So we are pleased to have a vendor who believes that they can get tablets to the area agencies on aging in the next few weeks, and then hopefully we can get those distributed by the end of the year. So we are pleased to report that this morning.
Just adding what Marlene said, social isolation for elderly staying in their homes, particularly in the small towns with the COVID pandemic.
Yeah, that's what I heard. Marlene, we might ask you this, and the AAA directors will help us also. If we do provide tablets such as iPads to those individuals in their homes, we assume that we will need some training of those folks, but hopefully we can use these iPads so that seniors can connect with their family members, be able to connect with technology. Does that sound like something, Marlene, from your vantage point, that might work?
She also add our long-term care residents are really missing their families with little or no family contact.
We would agree. Are those residents in nursing facilities or assisted living? Is that who you're referring to, Marlene? If it is, I might also mention that KDADS did stand up I doubt whether they would be able to handle iPads because they are not so tech savvy. Okay, we hear you on that as far as some individuals may not be able to handle the iPads because they are not tech savvy, and we understand that, and we'll be prepared to hopefully coordinate with the AAAs on some kind of training. Cynthia, we might make a note of that. Also, Marlene, I might let you know, again, this is Janice DeBoer, that we did provide some tablets to nursing facilities and assisted living buildings to those individuals so that they can connect the residents in their facilities to their loved ones if at all possible. So we are trying hard and working hard to get as much technology available as we can to connect folks to individuals in the community. What else? What else do you want to share with Christina and her team? Oh, there's Marlene again. Go ahead, Christina. Go ahead, Cynthia.
Yes. She say, I'm a nurse and I have worked in nursing homes. The iPads do not work as well as we would like. I often use my own cell phone for the family to visit with their residents.
Oh, that's good to know. We appreciate that feedback. So be sure and share more with us on that as far as why they may not be working well for nursing facility residents. Marlene, we appreciate hearing that. We have heard from some folks that it's working really well, but in your area, it doesn't sound like it is working as well. Okay, we'll make a note of that.
Things to consider, she said, is visual problems, lack of opportunity for the iPad availability, as well as their hardness of hearing.
Okay, good. Good to know.
Mm-hmm. Thank you, Marlene.
Who else? Who else would like to share a success story or share a concern or?
This is Laurel in Wichita. Can you hear me?
I might speak up just a little bit, Laurel.
Okay, let me get close. Must be my phone. The loneliness and isolation is very concerning for our people. I think a lot of our meals clients aren't even going to the doctor because they're afraid. And it's really gotten bad here in Wichita in the last couple of weeks. So we're at really high rates of infection. But we're looking at ways to maybe engage them. You know, some of our older volunteers who aren't coming back, perhaps they can make calls to the clients that they delivered to. And we're also looking at maybe getting some interns college interns through Wichita State or other colleges here to make some of those calls, just to check in and let them know we're thinking about them and if there's anything they need. So if anybody else has ideas about how to reach out to those people, that would be great. Most of ours do not have technology, so I think phone calling is probably going to be the way to go. But if other people have ideas, if you could share that, that would be wonderful.
We appreciate hearing that, Laurel. Yep, sometimes just the landline might be the best way to connect, it sounds like.
Just want to add real quick, Marlene said there's nothing unfortunately like face-to-face visits, either in nursing homes or at their own home. She agrees social isolation is an issue.
Yes, we agree, Marlene, completely with your observation. We agree. We look forward to the day when we can go back to normal, if you will, although some folks keep reminding us that normal may never quite be the same. We may always need to be very cognizant of infection control and distancing within reason. But certainly we look forward to the day where we can have more face-to-face visits again. Okay, what else? This is a good group. From what we can tell, we've got several other people on the phone that we haven't heard from. If you don't want to speak up, don't feel pressured to do so, but this is your opportunity. Or, as Christina mentioned, you can go in and complete our Survey Monkey. We'll wait just a few more minutes, Christina.
Yes. Sorry. I can't see the chat, and it's kind of driving me crazy, so.
Oh, no. Well, Christina, if you want to stop your presentation so you can see the chat, would that help?
Yeah, is everybody okay with that?
I bet it'd be okay.
Okay. All right, that's so much better. Sorry. I saw somebody on the phone that was getting ready to talk, so I'll be quiet and let you come back on if possible.
Would you all like me to go ahead and open up the phone lines in case people are having issues getting unmuted?
Sure.
Sure.
I have a comment from Marlene. She said, we really miss volunteers in the nursing homes. The staff is so stretched out and are trying to assist families and residents and provide love as well. Our time is limited and their needs are great. Staffing shortage due to COVID is tremendous out here.
Yeah, I'm seeing that staffing is a big issue, at least in the preliminary survey responses. That's a pretty common theme.
And just to let you all know, this is Janice DeBoer again. We do meet with the Nursing Facility Trade Associations every Tuesday morning just to stay apprised of what is going on, and they too have been communicating to us that the staffing concerns are top priority right now, that they are concerned about staffing shortages due to COVID and how that will impact the care to their residents. So they let us know that staffing is a serious issue for them. So we appreciate hearing that from you also, Marlene.
Yeah, I appreciate that. I'm glad to hear, Cynthia, that we're getting some responses on staffing, nursing facilities, but also, you know, what can we kind of try to help as far as staffing, just in general, maybe not just the nursing facilities, but so that's good that people are providing feedback regarding that.
Marlene also say nurses become ill with COVID, so they are then isolated.
I do have all the lines unmuted, so if you're on the phone and or would like to share.
I might just ask the nutrition providers, are you still, Laurel, are you still doing grab-and-go meals, or are folks coming back into congregate settings, or what are we seeing out there as far as congregate meal sites? And Kathy, congregate meal sites are those the senior centers across the state oftentimes have meals brought in to folks, but I don't know that we have a lot of congregate meals happening right now. But is there any feedback from anybody on what's happening out there currently?
Janice, Laurel is a home-delivered exclusively provider,
Okay.
But we hear on our biweekly nutrition calls, there's very few congregate sites that are open, and if they are, they're in more rural areas, and they're at about, on average, half capacity is what I'm hearing.
Okay, so there's an opportunity for social distancing.
Yeah.
Okay.
A lot of them are following, all of them are following it, the guidelines.
Yes. Gabrielle, this is Laurel. Yeah, our 4 senior centers, 3 of those where meal sites are still closed. So
Good.
I think Rosie's doing what she can, but it's limited.
So Marlene is seeing that the survey is not active, which it should be.
Yeah, I'll try to send the link again.
And I think, Gabrielle, Cynthia, isn't it also on our Facebook, KDADS Facebook page, the survey link? So you need to go to Facebook, it has it, and then the KDADS website has it also. So yeah, if we can just make sure that's active.
It is active.
Okay, so it may be just an issue with the link inside the chat.
It's a typo in the link. Here.
Okay, sorry about that.
Thank you, Marlene, for bringing that.
Sorry about that.
If that works.
Okay, do you send it?
Yeah, that one should work.
Thank you, Gabrielle.
Well, we'll give a couple more minutes, but if nobody has anything in additional, we'll go ahead and end this session about a little bit early. Maybe one last chance for any feedback for this session, and then of course you have the written comments and you have the survey. Okay, well, I just want to take this time to tell everybody thank you for participating. If you know anybody who would like to participate, December 9th is our last listening session. We always have the written comments, of course, and then the Survey Monkey. But that will be our official last